Welcome to our video on the Mental Capacity Act 5 principles. The Mental Capacity Act is underpinned by 5 key principles. It's useful to consider the principles chronologically. Principles 1 to 3 will support the process before or at the point of determining whether someone lacks capacity. Once you've decided that capacity is lacking, use principles 4 and 5 to support the decision-making process. So these are the 5 key principles. And the first one we're going to look at is a person must be assumed to have capacity unless it is established they lack capacity. The presumption of capacity. Until an assessment has been made and documented, we should always assume our patients have capacity, and we should only assess when we have reasonable belief that the patient may lack capacity. Principle number 2 is a person is not to be treated as unable to make a decision unless all practicable steps to help them do so have been taken without success. Practicable steps are the things that it is possible and appropriate for you to do in order to support the person to make a decision. You can provide relevant information. Does the person have all the relevant information they need to make the particular decision? If they have a choice, have they been given information on all the alternatives? Communicate in an appropriate way. Could information be explained or presented in a way that is easier for the person to understand? Have different methods of communication been explored if required, including non-verbal communication? Could anyone else help with communication? Make the person feel at ease. Are there particular times of the day when the person's understanding is better? Are there particular locations where they may feel more at ease? Could the decision be put off to see whether the person can make the decision at a later date when the circumstances are right for them? Support the person. Can anyone else help or support the person to make choices or express a view? So back to the 5 key principles, and we're now going to look at principle number 3. A person is not to be treated as unable to make a decision merely because they make an unwise decision. People have the right to make decisions that others might think are unwise. Don't be judgmental. The fact that someone is making an, in inverted commas, unwise decision is not reason enough to deem them to lack capacity. It may give rise to a capacity assessment, or it may be grounds for a capacity assessment. So back to the principles, we're going to look at number 4. An act done or decision made under this act or on behalf of a person who lacks capacity must be done or made in their best interests. We are doing a separate video going into best interests in a bit more detail, but on this occasion we will just run through the basics. That best interest decision making is not merely what you believe is in the patient's best interests. If the patient had the mental capacity to decide, what would they want? So the Code of Practice steps created 8 steps to help work out best interests. Number 1 is to encourage participation. Just because the patient lacks capacity doesn't mean we don't want to know their views. Number 2 is to identify all relevant circumstances. Number 3 is to find out the person's views. You might want to speak to family members perhaps and find out what their historical views were. Number 4, avoid discrimination. Number 5, assess whether the person might regain capacity. Number 6, consult others. Number 7, always avoid restricting the person's rights. And number 8, take all of this into account. So back to the principles, and we're on number 5. Before the act is done, or the decision is made, regard must be had to whether the purpose for which it is needed can be as effectively achieved in a way that is less restrictive of the person's rights and freedoms of action. This is the least restrictive option. Is there a way of ensuring the patient gets their care and treatment that they need in a way that is going to restrict their rights and freedoms less? Have you tried the less restrictive option first? Just as an example, before putting someone on a one-to-one, could they be given a falls map to alert staff when they get up? So a quick reminder, a person must be assumed to have capacity unless it's established they lack capacity. A person is not to be treated as unable to make a decision unless all practicable steps to help them do so have been taken without success. A person is not to be treated as unable to make a decision merely because they make an unwise decision. An act done or decision made under this act for or on behalf of a person who lacks capacity must be done or made in their best interests. And number 5, before the act is done or the decision is made, regard must be had to whether the purpose for which it is needed can be as effectively achieved in a way that is less restrictive of the person's rights and freedoms of action. Thank you for listening. If you're ever stuck, please call and ask for support from the Adult Safeguarding team. Our contact details are on Connect.